Hello, everyone. This is Dr. Dorette Noorhasan, reproductive endocrinologist and infertility specialist in the Dallas-Fort Worth area, as well as author of Miracle Baby, A Fertility Doctor's Fight for Motherhood, and the Fertility Manual, Reproductive Options for Your Family. Here today to talk with Tulsi Desai of Active Body, Active Life. Welcome, Tulsi.
Thank you so much, Dr. Noorhasan, for having me.
Tulsi, you are an active physical therapist here in the Dallas-Fort Worth area. Please tell us a little bit about yourself and about your practice.
So I'm a physical therapist, but I specialize in women's health and pelvic floor physical therapy, which is slightly different than regular physical therapy. And we help women with any concerns during pregnancy, postpartum, and if they're healing from any surgeries, mainly a lot of abdominal and pelvic problems, bladder issues, bowel issues, sexual problems. And there is not enough awareness. A lot of people don't even know that there is a specialty called pelvic floor physical therapy. So that's what I do. And I'm really trying to raise awareness about the fact that there are resources out there for women and they don't even know it.
And I've heard so much about physical therapy. I personally have seen physical therapists throughout my lifetime after injuries, those types of things, but I don't know that much about pelvic floor physical therapy. Can you tell us some details about pelvic floor physical therapy?
Yeah, and I'm not surprised. I have met a lot of women who come to me for consultation, and generally they find me online or they have heard about me from other patients because they're not being referred by a lot of doctors that they're seeing. And it's a relatively newer field. Like, it's not as old as orthopedic physical therapy or neurology or cardiology, but pelvic floor physical therapy has been around. And the difference between regular physical therapist and pelvic floor physical therapist is more of a super specialization. We do all go through same schooling for physical therapy basic education, and then the therapists who are specialists into pelvic floor, we just go ahead and pursue more education to understand special needs of women in pregnancy and postpartum and the pelvic floor, which we are not taught as much during undergrad. So it's a very complex area. It connects the spine with the hips and upper body with the lower body. And there are so many structures that can affect top and bottom both. So we understand the role of pelvic floor in relation to urinary system, gynecological system, colorectal system, and how it influences them, or those systems can influence pelvic floor and create some dysfunction. And we go into a lot of details of understanding the processes, and then accordingly we can help women with their unique problems more efficiently.
That's fantastic. And, it's very important that women learn all their options that are available to them. And it sounds like it's a great option with urogynecological problems, urinary incontinence, those types of things. And most recently, I've learned about the role of physical therapy in infertility, and that was quite enlightening for me. And there are many reproductive endocrinologists and infertility specialists like myself who don't know about the role of physical therapy in infertility. So can you tell us a little bit more about that?
Yeah, so pelvic floor has so many ligaments and fascia and muscles and different myofascial structure, soft tissue around the organs, and blood supply, lymphatic system. It's a very intricate system, and anything that is not functioning optimally with one of these systems can affect reproductive function of a woman. So not every type of infertility is going to require pelvic floor physical therapy. We may not be able to treat every type of infertility, but especially if it's a mechanical infertility where somebody has a lot of scar tissue or restrictions, tissue restriction that's impairing blood circulation. It's not allowing oxygenated blood to come to the organ, or it's not allowing the toxic blood after to go back to through the venous system, or it's not allowing the lymphatic system to do its function, and there is a lot of lymphatic congestion. A lot of these factors can interfere with the reproductive function at physiological level as well as anatomical level. And it can affect the organ visceral mobility within the pelvic area, and as well as especially when we talk about circulation, it can also affect, if there is a lot of congestion and impaired circulation to the reproductive organs, it can affect how the hormones, how efficiently the hormones are arriving at the target tissue, and that can in turn affect the reproductive function. So the way pelvic floor physical therapy can help with infertility in some way is releasing a lot of scar tissue, releasing a lot of tight tissue restrictions, and improving circulation, improving lymphatic drainage to create that decongestion, so that these organs have the nutrition that they need, the tissue quality is better, and the hormones are able to reach the target tissue and do their job. So I think that's the easiest way I can explain how pelvic floor physical therapy can help. But we can also look at the ligaments, because a lot of we need these ligaments to support these organs, uterus and ovaries, within the pelvic cavity. If these ligaments are restricted, that can also affect how these organs are aligned within pelvic cavity, and that can affect conception. So these are all mechanical reasons, and I think that's where pelvic floor physical therapy can help the best. But there are also going to be patients where there are too many unknown factors. You're not able to, even as after running all the blood work and everything, there are times we can't find what's really causing infertility, and it would be worth giving it a try. We don't have a lot of research supporting it, but we have had enough case studies where it shows how somebody was dealing with infertility for 5 years of trying IVF, multiple rounds of IVF, and they weren't able to conceive. And then they had manual therapy, all these myofascial release and everything, and within few months they were able to conceive. So as much as we have all these advancements, if there is a mechanical factor impairing the function of the organ, I think we can use it as a team approach, multidimensional approach, and do parallel treatments so that there is increased chance of conception naturally or with IVF. And also when we release all these tight areas, it's also going to improve the overall experience of pregnancy. If there is pelvic asymmetry, if there is a sacrum or tailbone that's not aligned properly, a lot of pelvic floor muscles are attached to those areas. And if we can realign all that and improve the body mechanics, that will also help with throughout the pregnancy and maybe less struggles. So I really feel that women who have already either failed IVF or there are unknown factors, and if they want to give it a try, it would be worth trying to see, at least get an evaluation done to screen if they have any factors that physical therapy can help with. So we are ruling out things that would interfere with the conception and facilitate the conception as much as possible.
Yeah, I absolutely agree with you. My approach is that infertility is a disease that can be treated or have a multi-specialty approach. And, you know, I do a lot of infertility, but many times I will send my patients for acupuncture. They will need counseling or psychotherapy in terms of helping them with their mental state. So there are multiple specialties that have helped me with my patients. And I'm really glad now that I've learned about pelvic floor physical therapy in terms of fertility treatments, particularly like you said, for those with scar tissue. So tell us, how can patients reach you if they would like to try pelvic floor physical therapy as part of their fertility treatments?
So my website is called www.activebodyactivelife.com, and I have a Facebook page. It's Active Body Active Life, and same for Instagram. So they can go to one of these pages and try to contact me, send me a private message, or they can send me a email through my website. So there is a page where they can send a message, and I'll get it in my email. I would also like to add that there are conditions that women can actually suspect, or even doctors can use those to kind of rule in or rule out if they want to recommend physical therapy for pelvic floor physical therapy for these patients. So if somebody has had endometriosis, they have a lot of scar tissue around their uterus and bladder. So if the uterus and bladder mobility is restricted, they can also have a lot of bladder issues, or they may not have it, but they could still have a lot of restrictions between these two organs, and that can mechanically affect conception, or being able to carry child to full term. And we can't prove all of that, but we have to use this medical knowledge and see if that would help these women minimize all the barriers that they might be facing with fertility. Any abdominal surgery, pelvic surgery, appendix removed, all these surgeries could lead to some scar tissues and myofascial restrictions, so different connective tissue restrictions, and that can of course lead to more blood circulation problems. And also all these would change nervous system, and we know nervous system is what regulates every function of every tissue in our body. So if we can normalize the nervous system, that can also hopefully reduce the barriers to conception. There are people who have severe pain with penetration or sex, and that can lead to a lot of muscle spasm that can in turn change nervous system. So if we can treat those trigger points, muscle spasm, and normalize the pelvic floor muscle tone as well as neuromuscular coordination, we can kind of, in a simple language, we can reboot a lot of things that can also reduce the barriers towards infertility. And I have heard where some patients are not interested in sex. They don't want to have intercourse, and they might just take shortcut of doing IVF. It might be worth asking them why they don't want to have sex. Is it painful? Because if it's very painful and that's why they're avoiding it, we now know that the nervous system may not be functioning optimally, that muscles are not probably functioning optimally, bone alignment might be slightly different, and that can still impact their pregnancy later on. So if somebody's interested in removing as many barriers as possible for to increase their chances of conception, as well as healthier pregnancy, it's definitely a very valuable resource. And I hope that's helpful. And people who are struggling or who have failed IVF already, hopefully they can, and if they haven't tried this, it would be worth for them to try it, as long as there are indications for them to try it.
That's fantastic. Do you have any final tips or words of advice for our audience in terms of pelvic floor physical therapy, particularly as it relates to fertility?
I think they'll have to do the evaluation, because again, there are so many factors that affect it. As we generally advise everybody that, for example, you might be advising people work on your stress level and mental health and all that. Pelvic floor physical therapy can help with anatomical and physiological health. That's also one component that's important for a function. So if somebody is not sure where they can find a therapist, reach out to me. Even if you're in a different town, I'll find you somebody that's in your area, and I would love to help you out.
Wonderful. Well, Tulsi, thank you so much for being on the show with me and for educating our audience about physical therapy and its role in fertility.
Thank you so much for having me.